So as part of our conversations with our friends from Cambridge University Health Partners, I'm delighted to be joined now by Tracy Dowling, who's the Chief Executive at Cambridgeshire and Peterborough NHS Foundation Trust. Tracy, thank you for finding the time to be with us. Maybe do you want to say a few words about the trust and the services you provide?
Thanks, Richard. So Cambridgeshire and Peterborough Foundation Trust is an integrated mental health and community services trust. So we look after people's physical health and their mental health. Our boundary of Cambridgeshire and Peterborough is pretty much aligned to that of our integrated care system. We do also provide eating disorder services in Norfolk. We have about 4,000 staff, over 1 million consultations with patients a year. We have inpatient mental health services, some specialist services like eating disorders and child and adolescent mental health tier 4 services, but also community rehabilitation wards dotted across the county for physical health care, most of those being people who are stepping down from an acute hospital stay.
Do you want to say a bit more about sort of partnerships you may have had with technology companies and some of the opportunities that might be there for the future?
Yes, certainly. So we have a really good partnership with Microsoft, and we already had the full Microsoft suite in place before COVID hit, which meant we could move really quickly. We also engaged with a digital company that support mental health called Helios for our child and adolescent mental health service, which had a big backlog and a long waiting list prior to COVID. And during COVID, actually, jointly with Helios, we have massively reduced that backlog, if not almost eradicated the backlog for assessment. And that has, I think, shifted the way in which we will continue to use digital technologies and to work with partner organisations to jointly deliver care. We also had some experience, but really limited, of using things like pulse oximeters in care homes, and again, through virtual means, looking at how we remotely monitor. But there are some things that I think we didn't do, and some areas where I think there are further opportunities to develop partnerships with industry around physical health monitoring for patients in the community, but also for our mental health patients. You know, nobody only has mental health or physical health. All of us have both. And I think one of the things that hasn't had the attention that it could have is how with industry we can develop means to better monitor and manage the physical health of patients with mental health. Their life expectancy is 20 years shorter than people without serious mental illness because of the physical health consequences of both the illness and of the medications that they're on. And we have seen, we're beginning to get some research emerging from one of our research psychiatrists, that actually people with serious mental illness had a higher mortality rate during COVID than people without serious mental illness. So there is definitely something within that we could explore together.
Well, that's fascinating and really, really interesting, Tracy. Hopefully this conversation will prompt people listening in to say, actually, yes, I can see that, and they'll be beating a path to your door. And I look forward to facilitating some of those conversations. Let's change track slightly, if I may. Integrated care systems. You had a really interesting career. You've been a poacher turned gamekeeper turned poacher again, probably in all of that. I think for me, particularly mental health, integrated care systems offer real opportunity. I remember a few years ago, if we roll back to 5-year forward view and the Vanguard programs, one of those was in mental health, and I remember Dame Julie Moore, who was Chief Executive of University Hospitals Birmingham at the time, saying of a street triage programme actually in Birmingham that was early interventions for people who would otherwise have had some sort of mental health crisis and probably ended up either in a police cell or at the door of the accident emergency department, saying this initiative has really reduced my A&E admissions significantly. So I just see that as a huge opportunity. You've worked on both sides of it, commissioning and provider. What's your view? Maybe if you want to say a little bit about how things are developing in Cambridge, but generally your view of integrated care systems and where we're going to get to in the next few months?
So I think integrated care systems have got a long way to go, actually. Our partnership, and I think I emphasise it is about partnership, absolutely has the health needs of our population at its core. And I think it's not about competition between providers and commissioners, or between different providers about who takes over who else's business. It is about us all collectively and collaboratively understanding the health needs of our population, and how do we best join up delivery with those communities and the people in them at the centre. And that sounds it sounds good, it sounds glib, but it sounds quite difficult to make tangible. We've got an exemplar programme for mental health in Peterborough. We're one of the early implementers for the new community models of mental health. The thing about that is it is about it's about rubbing out the boundaries between secondary care, primary care, social care, and between healthcare and communities, so that people can access the support they need when they need it. And that's really difficult with mental health, particularly if perhaps you're homeless, you have an alcohol problem, you may take drugs and have an underlying mental health condition. Actually, for people who are that vulnerable, it's really hard to get the support that they need. So we're working with the communities. We're investing in more healthcare roles, but we're equally investing in social care roles, in community-based roles, in roles that specifically reach out to people who currently find it really hard, and they find it really hard to get the support that they need. But an integrated care system is about understanding your population and jointly working together to do better for them, but to do that with them. So for mental health, I think we're making some really good progress. Also for eating disorder services, or people with eating disorders have the highest mortality rate of all mental health conditions. And again, that's because of the physical health impacts of that mental illness. I do think that there are still opportunities. Again, it's around that physical mental health interface for us to better join up with industry partners and tech partners to help us to make those connections that are so vital in an integrated care system. It's about understanding data and using the data about your population to drive your decision making, and it's about doing that at a macro level, but also at quite a micro level, day to day, operationally as well. And one of the things that for me is really important is how do we develop I hate to say the word, the algorithms, the filters that can really help our frontline clinical staff using technology to know who are the people that I need to see to be proactive and preventative, and what's just noise that is noise but doesn't mean I need to mobilise a response. And I think we'd be really up for doing some work with partners to start to develop that in quite a sophisticated way.
Okay, that's really interesting, and an offer for people listening. And then just perhaps a bit more future gazing on the integrated care system. I asked you this because I think the services that you run, the mental health, community healthcare services, are closer to the sort of wider determinants of people's health status. You touched on this already: homeless people with chaotic lifestyles. I mean, for me, I always saw the integrated care systems as the first step. You join up the NHS or the health pounds in Cambridgeshire and Peterborough, and the next step then is joining up the wider determinants of health. So I often thought, we mentioned police before, I guess I would imagine 40% of what the police have to attend to are basically mental health issues. They don't want to do it, they're not the right people to do it. If we could if we could invest more in mental health services, homelessness and such like, I think you'd free the police up then to do. You probably have to give them less money, and they'd have more resources to do whatever it is they need to do to keep us all safe. Is that too bold an ambition? Do you think that's where we might be headed in the future?
So I think I have a slightly different take on that. What I would like to see is that I don't think mental health should be entirely the domain of the NHS, and that only mental health professionals should have competence and capability to look after people who have got mental health needs, because everybody has mental health to one degree or another. What I would like to see is much wider and training of our police, of social care, of teachers in schools, of the population at large, to understand mental health and to know how to have those compassionate conversations with somebody who has got mental health needs, but also that we make it really easy. This is what we're doing with our exemplar. For those people who are encountering somebody with needs, to access the help and support that is more specialised really, really quickly when those needs arise.
That's great, and actually it probably gives us a chance to finish on a plug for Mental Health First Aid England. The chief exec, Simon Blake, did a blog for us recently. We did a little blog around mental health, as we're all, the pressure that we're all under, having to work in different ways, and the anxiety that I think, I certainly feel with everything that's going on. So Tracy, thank you so much for those thoughts today. That was some really, really stimulating stuff there. Hopefully it'll get people listening in to think a little bit differently about how they might deliver some of their services. And thank you on behalf of all of us for everything you do, working in absolutely critical part of our health and care system, and probably the most challenging in many ways. So thank you for finding the time today.
Thank you.